This patient was referred to me for endodontic treatment of teeth number 2 and 3. According to the patient, the bridge is 8 years old and patient swears that she flosses and brushes her teeth. She has dental anxiety, dentophobia, a little bit, dental anxiety a lot. So that's why she's been putting off going to the dentist. I guess recently there was enough symptoms and these holes were big enough because she said she could feel the holes with her tongue. That she went and saw her dentist, and her dentist told her she needed 2 root canals, refer her to me. So take a look here. You can see porcelain bridge here. You can see subgingival decay here, tooth number 2. You can see composite restoration and recurrent decay right there. So I recommended that she go ahead and extract tooth number 2. That decay is just huge. Tooth number 3, the decay is large and subgingival, but this is kind of an important tooth, and patient really didn't want to go the route of implants and partial denture and all that stuff. She really wanted to try to see if the bridge could be maintained. So sometimes you got to do what you got to do. Sometimes your treatment plan is not ideal, and I'm talking about you as a general dentist. So you kind of go based on what the patient is demanding at the time. You discuss the guarded prognosis and the life expectancy and all that stuff with the patient. Patient ask question, you answer questions, you have the patient sign the consent form, and you go from there. Sometimes, you can't force people to do stuff that they don't want to do. This was a restorable tooth. If it was not, I would have probably tried to convince her, or would have just not done the root canal altogether. But in this case, I realized that the patient really didn't want to go the route of extraction, implant, or extraction and a partial. So this tooth was an important tooth, and I did my best to try to save it for her. As I said, she'll have tooth number 2 extracted, however. So take a look here. Today, went through the porcelain bridge, removed the decay, rebuilt the missing wall, and did the root canal for this patient. And here it is. As you can see, everything actually went great. As always, I troughed for an MB2, wasn't there. About 40% of the time these teeth have an MB2. I'm sorry, about 90% of the time these teeth, 90% and more of the time these teeth have an MB2. About 40% of the time the second molars have an MB2. But this is tooth number 3, so this is the first molar. About 90% of the time they have an MB2. So if you don't find it, you better know for sure that it's not there. Just because you can't find it doesn't mean it's not there. But in this case, of course, I'm a MB2 finder god. I use a surgical operating microscope as well, 23 years of experience. So one was not there, and the other way you can tell is you can see how centered this gutta percha is. The distance from here to here and here to here are exactly the same. All right, so that's another. But anyways, another way. Anyways, as you can see, everything went beautifully. We temporized the tooth and referred the patient back to her dentist for the permanent restoration. As I said, she'll have tooth number 2 extracted. But tooth number 3, root canal, went great.